I'm John Strum, and this is Real Talk MS. It's December 17th, and we have a lot to talk about. There's an alarming shortage of neurologists in the United States. That shortage makes it hard to get in to see a neurologist, and in some regions of the U.S., you may not even find an MS specialist without having to travel hundreds of miles. The good news is now there's an app for that. Joining me to talk about how an app called BeCare is already changing the game when it comes to MS care and treatment is the Chief Medical Officer of BeCareLink, Dr. Charisse Litchman. But before we get to my conversation with Dr. Litchman, there are a few other things that you should know about. While we were at ECTRIMS in September, we shared the positive results of a Phase 3 clinical trial for Tolebrutinib, an oral medication that represents a new category of MS disease-modifying therapies called BTK inhibitors. The results of this large clinical trial demonstrated that Tolebrutinib was effective in slowing progression among people living with non-relapsing secondary progressive MS. It's the very first drug to demonstrate efficacy in treating non-relapsing secondary progressive MS. And as a result, last week the FDA designated Tolebrutinib as a breakthrough therapy for the treatment of adults with non-relapsing secondary progressive multiple sclerosis. This designation expedites the development and review of new medicines, which is great news. Medicines qualifying for breakthrough therapy designation must first show preliminary clinical evidence that the drug may demonstrate substantial improvement on clinically significant endpoints over available medicines. Sanofi, the pharmaceutical company that manufactures Tolebrutinib, is currently finalizing its submission to the FDA and preparing its submission to the European Medicines Agency, or EMA. I'll also add that Tolebrutinib demonstrated the same efficacy in slowing MS progression among people with relapsing forms of MS, and results of a clinical trial to determine the efficacy of Tolebrutinib among people with primary progressive MS are expected in the second half of 2025. So we're sure to be hearing more about Tolebrutinib in the weeks and months ahead. If you'd like to hear the details of that Phase 3 clinical trial for non-relapsing secondary progressive MS, be sure to check out my conversation with Dr. Robert Fox, the principal investigator in that trial. It's part of our ECTRIMS playlist on the Real Talk MS YouTube channel. And you'll find a link to our channel in today's show notes. The Phase 2 clinical trial for Foralumab, a nasal spray being tested for the treatment of non-relapsing secondary progressive MS, has expanded to 6 additional sites across the northeastern United States. The new sites include Yale University in Connecticut, Johns Hopkins University in Maryland, Cornell University and the University of Buffalo, both in New York, the University of Massachusetts, and Thomas Jefferson University in Pennsylvania. Tiziana Life Science, the company that produces Foralumab, explained that the reason they were only adding these additional clinical trial sites in the Northeast is because every trial participant has to receive a PET scan at a single imaging site that's located in New Haven, Connecticut. This ensures that every trial participant will be examined with the same scan using consistent imaging protocols, which will minimize any variability in the resulting scans. Foralumab is designed to target a protein called CD3, which is found on the surface of T cells. The mechanism of action reduces the activity of inflammatory T cells and increases the level of activity of anti-inflammatory T cells. The expected outcome is this will reduce activation of other immune cells, like microglia, reducing inflammation, which will slow MS progression. Foralumab is already being tested in 10 people with non-relapsing secondary progressive MS in an expanded access program. Each of these 10 participants receive a spray of Foralumab in each nostril 3 times a week for 2 weeks, followed by 1 week of rest. The treatment continues for more than 6 months, and so far data shows that 8 out of these 10 individuals has a reduction in microglia activity, and 7 out of 10 also reported less fatigue after 6 months. Based on those findings, the FDA allowed Tiziana to enroll an additional 20 MS patients into the Expanded Access Program, and the Phase 2 clinical trial, which began at Harvard's Brigham and Women's Hospital, will be enrolling as many as 54 people with MS who are experiencing continuous disease progression despite treatment with other available therapies. If you're interested in learning more about this clinical trial and even participating in the trial, you'll find a link in today's show notes. I don't have to tell anyone listening to this podcast that disease-modifying therapies that help manage MS are expensive. And no one needs to be reminded that the cost of these drugs has continued to increase over time. Now, results of a recent analysis of out-of-pocket costs for medications for several different neurologic conditions show that the cost of DMTs for multiple sclerosis have continued to go up significantly, while costs for medications that help manage other neurologic conditions have actually decreased. Researchers from the University of Michigan and The Ohio State University analyzed commercial insurance claims to identify over 516,000 patients who were treated by neurologists from 2012 to 2021. These included 54,676 people with MS, 186,144 people with epilepsy, 45,909 people with Parkinson's disease, 169,127 people with peripheral neuropathy, and 60,861 people diagnosed with dementia and Alzheimer's disease. From this group, they included everyone who received a self-administered neurologic treatment that was covered by their health insurance up to 12 months after being diagnosed. The results of this analysis showed the average out-of-pocket cost of MS disease-modifying therapies increased by 217%, going from $750 a year in 2012 to $2,378 a year in 2021. Keep in mind, this is out-of-pocket costs only, not total cost of medication. And these out-of-pocket cost increases were the most significant cost increases observed among all the diseases being analyzed in this study. And when the research team looked at how costs of generic drugs impacted overall out-of-pocket costs, they found annual out-of-pocket costs for generic medications for every neurologic condition decreased by anywhere from 48 to 80%. That is, every neurologic condition except multiple sclerosis. In the case of MS, the researchers found the approval of glatiramer acetate, the generic for Copaxone, resulted in no out-of-pocket savings for people with MS. Now, I'm usually pretty good at using my words, but there are no words to describe this level of what can only be categorized as intentional, targeted price gouging. I'm hopeful that shining a light on this practice will help MS activists in their advocacy efforts to make these life-changing medications affordable for everyone. If you'd like to review the details of this study, you'll find a link in today's show notes. For many years, healthcare providers have recognized the potential benefit of certain medications that, while not specifically approved by the FDA for treating MS, can still be highly effective. This practice is known as off-label use, and it's a practice that may already be familiar to many of you. Recently, I had an opportunity to have a quick conversation about the risks and benefits of using off-label medications with Dr. Allison Magruder. Dr. Magruder is a clinical pharmacist of neurology and dermatology at the University of Missouri's Mizzou Specialty Pharmacy. In a moment, you'll hear our conversation. For many years, healthcare providers have recognized the potential benefit of certain medications that, while not specifically approved by the FDA for treating MS, can still be highly effective. This practice is known as off-label use, and it can provide additional options that may be more affordable and sometimes even preferred by insurers. Joining me to discuss the use and advantages of off-label medications is Dr. Allison Magruder, a clinical pharmacist of neurology and dermatology at Mizzou Specialty Pharmacy. Welcome to the podcast, Allison.
Thanks for having me, John.
Let's start with the definition. What does off-label use mean?
Off-label use is any time that we use a medication that is not the way that the FDA approved it for. So when the FDA approves a medication, it has a very specific label. It could be an indication like it's not for MS, or it could be that it's not for MS patients with pregnancy or some other condition, and then we use it that way. So anytime we don't use it the way the FDA approved it for.
Well, with 20 disease-modifying therapies that are approved for MS, why would a healthcare provider prescribe an off-label medication instead?
There are a few different reasons. I probably won't even touch on all of them, but biggest ones might be that we've went through all of the classes of medications and we had either failed it with relapses or we had an adverse event or an allergic reaction, and so we don't want to try other ones. And so we're going outside of what we've tried before. It could be because we fall into a special population. So we might have some sort of chronic kidney disease, or we're pregnant, we have something else going on, or maybe we have an autoimmune condition that kind of overlaps with the MS. And so there might be a treatment out there that's technically not approved for MS that would treat our other condition, but we know could work in MS too. So there's some different reasons why there.
Well, with off-label medications not being approved for a specific use, is there usually evidence to support prescribing these off-label medications? Have studies been done?
So most of the time when your prescriber is prescribing an off-label medication, it's because there's data out there. There were studies that supported it. It could be that we don't have a lot of options, so we're grasping for anything. Or it could be that we have really robust data and we just never got it approved through the FDA. So that kind of depends on your personal situation, but talking to your doctor about that would be important.
Are there risks associated with taking an off-label medication?
Yes, but there really are risks with taking any medication, and those should be discussed with your doctor when they're prescribing anything. The thing about off-label is that we may not have as much idea what the risk is. Generally, I would say we do. When a doctor is choosing to prescribe it, it's because it's very commonly done that way. But there could be situations where it's personally, you fall into a special population that there's just not much data about. And so there might be more risk that we just are unaware of.
So if someone is prescribed an off-label medication, is there a different process for gaining approval from their insurance company?
It kind of depends on each individual insurance company. They all have their different rules, and some might even prefer a cheaper alternative, so they may ask you to go off-label. But if we are picking off-label and they're saying, oh, it's not FDA approved for this, generally what we do is give them supporting evidence of why we are choosing that route.
Well, what are some common MS symptoms that off-label medications might be able to treat?
For fatigue, sleep disturbances, that nerve pain, urinary symptoms, really a lot of them may not be completely studied in the MS population, but based on how we know it works, we can kind of use that data to assume how it works. And then maybe it also later down the line has actually been studied in that population. It's a generic by that point, and so we haven't used the money to get through an FDA indication.
If someone is interested in exploring an off-label option, how and where should they start? And what's the conversation that they should be having with their healthcare provider?
Yeah, so the internet is a great tool, but I always want everyone to make sure that they're going to reputable sources. So the MS Society, other MS-centric websites, using Google Scholar can get some more medically educated journals if you're able to read through those, but they can be really confusing. So getting the information that you have access to, but then making sure you take that to your doctor and talk to them about it, because not everything that we read on the internet is true, or we may have misinterpreted it just because it's not in our thought process on how medications work and that kind of thing. So making sure that we have that conversation of, this is what I learned, what do you know about it?
Well, Allison Magruder, thank you for everything you do to help improve the lives of people who are living with MS, and thanks so much for talking with me today.
Thank you for having me on, John. It's been a pleasure.
Research has shown that adults with MS who have poorer socioeconomic status tend to experience worse health outcomes. But there hasn't been any similar research done looking at the health outcomes of children who have poorer socioeconomic status and are living with pediatric onset MS. So a team of U.S. researchers analyzed MRI scans from 138 children and teens who had been diagnosed with MS. The average patient age at the time these scans were done was 19.9 years, and most of these young people had been living with MS for 3 years or more. The research team didn't have access to data on individual household income, but they had each patient's home address. And working under the assumption that patients living in poorer neighborhoods could be assumed to have lower economic status, the researchers used these home addresses as a proxy for income level. The researchers focused on race, ethnicity, and the type of insurance these children and adolescents had. Those patients who were on Medicaid were also assumed to have lower household incomes. Statistical analysis of this information showed that the children and teens with poorer socioeconomic status tended to have more inflammation, more brain damage, greater lesion volume, and a larger black hole volume. Black and Hispanic children also tended to show more brain damage. But the most important data point that this study produced was that being on Medicaid was the strongest predictor of brain damage in the statistical models that the research team had created. The research team also found that this impact of socioeconomic status was independent of other healthcare-related factors, like how quickly someone was seen by their neurologist or how soon they started MS disease-modifying therapies. So access to healthcare was not the driving force in these worse health outcomes. Instead, the study underscored the association between social determinants of health and the severity of pediatric onset MS, which implies that better economic and social support for less well-off families may lead to better health outcomes for their children. If you don't happen to be well-versed in social determinants of health, they're the non-medical factors that affect health outcomes. They include the conditions into which people are born, grow, work, live, and age. And they're shaped by forces and systems beyond the individual's control, like economic policies and systems, social norms, social policies, political systems, racism, and even climate change. Examples of social determinants of health would include education level, income, employment, housing, transportation, access to healthy food, clean air, and water, and access to affordable childcare, to name a few. These are the kinds of things that can only be fixed, or at least mitigated, through public policy. The CDC tells us that the 3 biggest health issues facing historically underserved populations today are health equity, health literacy, and the social determinants of health, none of which will be solved by a pill, injection, or infusion. I'm hopeful that at some point we can collectively begin working on real cures to these very real threats to public health, including those kids who are living with MS. If you'd like to review the details of this study, you'll find a link in today's show notes. We know that early intervention leads to better outcomes for people with MS, but how might you get that early intervention if just getting into a neurologist's office is difficult? Dr. Charisse Litchman joins me in a moment to talk about how BeCare, an app that can not only empower people living with MS, but make that whole process of getting care a lot easier. There's an alarming shortage of neurologists, which is a reality that some of you may already be personally familiar with. That shortage makes it hard to get in to see a neurologist, and in some regions of the United States, you may not even find an MS specialist without having to travel hundreds of miles. The good news is now there's an app for that. And joining me to talk about this award-winning app is Dr. Charisse Litchman, the Chief Medical Officer at BeCareLink. Welcome to the podcast, Dr. Lichtman.
Thank you. Thank you for having me.
So tell us, what is BeCare all about?
So BeCareLink is to address the problem of accessibility. We all know from all the studies that early intervention, early diagnosis, early initiation of medications, and then changing when you get worse, changes your ultimate disability. It's absolutely key that the patient and the doctor detect what's going on. It often takes a couple of years to make the diagnosis. Currently, because of the shortage of neurologists, 75% of all neurologic patients are seen by primary care doctors. Primary care doctors are excellent, but they're not trained in neurology, and they're not trained in MS. And they don't really know how to do an expert neurologic exam. So that's the problem in a nutshell. They cannot pick up the disability or the neurologic dysfunction that would then prompt the evaluation. But even once the evaluation is done, what's out there is they don't know how to treat once they find out that the diagnosis is MS. And once they initiate treatment, they often use one of the earlier medications, which are less effective, and are a little gun shy about making changes when it's needed. We have some powerful drugs that really can halt it in its path. But the more powerful the drug, the more side effects that it can have. And so they're hesitant, understandably. That's where BeCare comes in. We are the only tool out there that assesses the neurologic exam quantitatively. So we measure cognition, we measure motor, sensory, balance, visual, all of those things and more that even your neurologist would not have the time or the capability to do so in their office. We then generate a report or an overview against the general population. So you're not only able to follow how you are doing compared to when you first presented or suspected this, but you can also see where you stand now compared to your initial evaluation and where you stand compared to the general population.
So the BeCare MS app is one of actually a suite of apps. So can you just quickly tell us what each of the apps is, or does, I should say?
Absolutely. The central app is really the BeCare Neuro app. The BeCare Neuro app really helps screen for any neurologic disorder before you have a diagnosis. So if you think you might have MS, you would do the BeCare Neuro app, and you would pick up whether or not you're having an issue with your cognition or whatever. And then based on that, you would know whether or not you need to go to get an evaluation. Once you have the diagnosis made, whether it's MS or Parkinson's or Alzheimer's, we have different apps that can then monitor you to see how you're doing with the medications you're given. Really very current with some of the newer medications that are coming out for progressive MS, because we're used to people having relapsing remitting symptoms. We're used to there being a worsening and then an improvement. So it was very easy to keep track, or I would say easier to keep track of the number of flares that you were having. But now, because the medications are so good, there are really more and more people that have more of a progressive presentation. In other words, it's harder. The slide is more subtle. And it may be so subtle that the patient may not pick it up right away, but we would, because we are measuring minute changes in the neurologic exam in a quantitative way.
So now if we jump into the BeCare MS app in particular, one of the things it does is it calculates an EDSS.
That's right. So the disability score traditionally has been the EDSS. It's a scale that goes from 0 to 10. So 0 is no disability and 10 is deceased. The scale is very heavily weighted towards ambulation. A lot of it is subjective, cognition and some of the others, and it doesn't evaluate well visual. But nonetheless, this is the gold standard, and it's a very difficult score to calculate. So when you go to two different neurologists, they'll be 1 to 2 points apart on this disability score. And we did a study that compared BeCare versus a clinician, and we were less than 1 point apart. So what that shows is that we have a high accuracy and we're comparing apples to apples. The other thing is that the EDSS score, it takes a long time to calculate, and neurologists are not doing it as often as they need to. And so you may not be getting the EDSS score. Certainly general neurologists don't do it. But if they're able to look at the EDSS score, which has been proven to be robust on the BeCare app, then they can say, hey, there's been a change in disability. Even though I couldn't detect it, I need to act now. But beyond that, the EDSS is starting to come out of favor in favor of something called the tug, which is the timed up and go, which is you walk a certain distance, you turn around, you come back, you sit down. We have that also. And we can show where somebody scores compared to the general population. On top of that, we have neuro-ophthalmologic tests, cognitive tests. And so it's really a very powerful tool.
As you were explaining the accuracy of that BeCare MS app when it comes to EDSS, you mentioned that it was validated. Can you talk about that for a moment?
We did 2 trials, one at Cornell, one at Yale. And the earlier trial was looking at whether or not we could predict whether somebody was in a mild, moderate, or severe category for disability. And we were spot on about 90% of the time. The second study showed the exact score, and we were within 1 point of a clinician. Now, who was correct, the clinician or the app? We're within 1 point, and so that's very valuable.
It sure is. You know, I'm curious because we're talking about this in terms of it's difficult to have access to neurologic care. So someone who may not have that access is using the app. They use it, they get a measure, they use it 6 months later because maybe they're not feeling as well as they were, right? And so they use it again, and it seems that their score is a little worse. What is their next move? What can they do now?
Well, first they would reach out to their treating physician. But the other thing that they can do, which is a bonus at this point, with the advent of telehealth, is they can make an appointment at the Mass General, even if they're out in Idaho, right? And they can send their scores over, and the clinician at the tertiary care center sees what's going on and can then give advice to the primary care physician, if they're unable to travel. So it really makes telehealth robust because honestly, it's very hard to do a neuro exam on telehealth by vision alone. We add the quantitative part to that.
I'm curious, how many people are currently using BeCare MS?
We have over 15,000 users on BeCare in general, and we have over 10,000 on BeCare MS. And they found us pretty much organically, meaning that we're not doing sponsored ads or anything like that. But we have won a number of awards, and I think that's also helped draw attention.
Is there a cost associated with the app?
Using the app is free. There is a subscription, only $3.99 a month. If you want to have the written report that you can then have uploaded into your clinician's EMR, electronic health record. And the benefit to that is that it can be shared with other providers. So it's a valuable tool, but no, it's been free. It's always been free to use. And BeCare MS was our first app. It's where our heart is, and we'll always be there for those patients. Additionally, we've added a community onto the BeCare MS. So we have an area where patients can talk to each other and give each other support and advice.
Well, Dr. Charisse Litchman, I want to thank you for the work you and your team are doing to bridge that gap created by a shortage of neurologists and putting healthcare access for people dealing with MS, Parkinson's, and other neurologic conditions into a smartphone. Thanks so much for talking with me today.
Thank you.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/381. You'll find that link in today's show notes so you can easily copy and paste it right into an email or a text. And if you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.